Hello and welcome to the OMNO REDCap database launch introductory video. Oklahoma Mothers and Newborns Affected by Opioids is an initiative facilitated by the Oklahoma Perinatal Quality Improvement Collaborative in collaboration with the Oklahoma State Department of Health and the Oklahoma Department of Mental Health and Substance Abuse Services. OPQIC is funded by OSDH through the Title V Maternal and Child Health Block Grant Program and by cooperative agreement with HRSA and OSDH through the State Maternal Health Innovation Program. In this video, we will describe the process for OMNO data collection and entry into the REDCap database. Documents that we will be referencing throughout this video can be found at opqic.org/OMNO files. This page is password protected. If you need the password, you can contact info@opqic.org. The documents that we'll be looking at today include both the maternal and the neonatal data collection forms, the OMNO patient log, which is available in both an Excel and as a printable PDF, and the OMNO data metrics, which lists the AIM opioid metrics that we'll be using to report out our data results. The OMNO data entry instruments can be accessed by going to opqic.org/REDCap. Access to REDCap requires an OUHSC affiliate account. To request an account, go to opqic.org/REDCap account. Once logged in, you will see that you have access to the OMNO sandbox. This is a trial version of the project, so feel free to play in the sandbox and enter as many patients as you see fit to become acclimated to the system. We will not be using any of the data submitted into the sandbox for reporting. The official OMNO database, listed as OMNO Data Collection Tool, will be made available on November 2nd, 2020, so you might not see that project listed if you are watching this before then. We are asking hospitals to start collecting data from patients discharged on October 1st, 2020, and hold on to the information until the official database is available. If you have been collecting data on patients prior to that date, you may submit that as well. Let's click on the sandbox and take a look around. Once you are in the sandbox, click on the Record Status dashboard located in the left sidebar. We will discuss choosing an existing record later in this video. When entering a new record, click the green Add New Record button. You will be taken to the record's homepage. The new record will automatically be assigned a record ID. We suggest that you write this record ID on the paper form in the space provided, as well as the date that the data was entered. By doing so, it may be easier to find the record if necessary to come back to edit the data at a later time. We also suggest you consider some kind of a logbook to track all of your OMNO patients and match them to their record IDs. A sample log can be found on the OMNO Files page of the OPQIC website. Please do not send this log to OPQIC. This is for you to track OMNO patients in your hospital and a way to match their REDCap ID with their medical record number. Note that the record contains both the maternal and the infant data forms. The mother and baby are considered one record and therefore have the same record ID. This design helps us to link mom and baby data. In situations in which mom or baby are transferred to another facility, OPQIC will link and merge maternal and infant data upon data export. Notice that each form has a status icon in the next column. We will discuss the different statuses later in this video. For now, note that the status icon is gray, indicating that the record is incomplete with no data saved. Let's click on that gray status icon next to the maternal data form to begin entering the maternal data. Here we see an indication that we are adding a new record. Select your hospital from the drop-down menu. Hospitals are listed in alphabetical order by city. Enter your email address, as we will be using this as a way to contact you if OPQIC has any questions about this record. Click the Now button to enter the current date and time. This field is just a reminder of the criteria that we are using to determine if mothers or newborns meet the criteria for data collection. Next, choose the situation for the record you are creating. Do not skip this question, as the questions that follow will be altered by your response to this question. Select the first option if your hospital had no mothers or infants that met criteria for a given month. This will help us ensure we have received data from all hospitals. If selected, you will be asked to indicate the month and year and will be taken to the end of the record. Your hospital is considered the delivery hospital if the delivery either occurred in your hospital or if your hospital was the first hospital to admit the mom or baby following a home delivery or delivery en route to the hospital. Select the appropriate option in which both mom and baby stayed at your hospital. Mom stayed and baby was transferred. Mom transferred but baby stayed. Or the delivery occurred at your hospital but both mom and baby were then transferred. Select this option if the infant or fetus died. If you are the receiving hospital, select the option that best describes the situation in which you received only the baby, only the mother, or both the baby and the mother. Select the last option if you are entering data for an infant that has been readmitted to the hospital before 7 days of age. Then select the delivery hospital, even if the delivery occurred at your hospital. Based on the answers to these questions, the directions for what sections of the form you are to complete will change. In case of transfer, it is the receiving facility's responsibility to enter the data. When reporting data measures, the mother will count as a patient in the denominator of the receiving hospital. As many of you will be gathering this data using the data collection forms provided, we will be displaying the questions from the paper form on the left side of the screen while entering the data into REDCap on the right. Use of the paper form is optional. You may choose to gather data via an alternate method. Please do not send the paper forms to OPQIC. A quick note about design of questions on the form. For questions with answers listed as radio buttons, only one answer can be selected. If you need to unselect your answer, you can click the reset command and the answer will disappear. If the answers are listed with checkboxes, you can select all that apply and more than one choice can be selected. Required questions are indicated with an asterisk and red text. Next, we will begin entering the maternal demographics. In this section, enter the maternal age in years, followed by the maternal gravity status, including this current pregnancy, and parity broken down into previous term deliveries, previous preterm deliveries, previous abortions and miscarriages, and number of living children from previous pregnancies. Indicate the number of infants that were born alive from this pregnancy and the number of fetal deaths from this pregnancy. In the case of a singleton live-born infant, the correct options would be 1 and 0. Continue to fill out the form indicating the mother's race, insurance status, and zip code. The questions regarding delivery information and disposition are required. Enter in the date of delivery and gestational age in the format of weeks.days. For example, if the infant was born at 37 weeks and 4 days of gestation, you would enter 37.4. Indicate the mode of delivery and the maternal disposition, as well as the date of maternal discharge or transfer. The next section addresses prenatal care. This question aims to identify women with little or no prenatal care. Choose the first option if the woman received 3 or more visits, with at least one of those visits occurring prior to the 3rd trimester. Do not consider a visit to a clinic solely for a pregnancy test as a prenatal care visit. Optimally, this visit would be with a provider who can perform a physical assessment and appropriate screening. Select the second option if the woman received 2 or less total visits, or if her first visit occurred in the 3rd trimester. Select the third option if it is known that the woman received prenatal care, but the number and timing of visits is unknown. Select No if it is clearly documented that the woman did not receive any prenatal care. In the next question, indicate which conditions the mother may have experienced during pregnancy. Choosing Other will allow you to free text any relevant conditions. Multiple conditions can be selected as applicable. The next question attempts to assess testing for sexually transmitted infection. This is a required question to assess AIM process measure optional P6, percentage of women with OUD screened for STI during pregnancy. Please indicate which test the woman received and if this testing occurred either prenatally before the birth hospitalization, during the birth hospitalization, tested but timing is unknown, or the woman was not tested, or it's unknown if she were tested. Please indicate the option for each hepatitis B, hepatitis C, HIV, and syphilis. Answer these questions to indicate any documented neuropsychiatric diagnoses or prescribed medications. The data collected from this required question will help us assess our progress in earlier identification of women with OUD, and will also help us establish a denominator for some of our AIM measures. So please indicate when maternal opioid use disorder was first identified. It can be before current pregnancy, during prenatal care for the current pregnancy, during the delivery hospitalization, or after the delivery. If timing is unknown, select the last option. Answers to this next question will be used to calculate process measure P1, percentage of women with OUD during pregnancy who receive MAT or behavioral health treatment. Medication-assisted therapy would be a prescription of an opioid replacement. Types of behavioral health therapy include inpatient and outpatient programs, counseling sessions, peer support groups, and other activities with a mental health professional for the purpose of addressing the substance use disorder. Please answer yes to this question only if the treatment or service occurred during the pregnancy. Treatment after delivery of the infant, even if it occurred during the birth hospitalization, does not count for this measure. If the answer to this question is no, you may then skip to the next question. In REDCap, the next questions will not appear. If the answer to one of these is yes, the appropriate related questions will appear and are required. The further questions regarding MAT may include information on daily dosing. Morphine milligram equivalents, or MME, can be auto-calculated from these answers. Some hospitals may find MME data helpful, and it can be potentially included in hospital reports. Dosing documentation is optional. Data from this question will help us report AIM process measure optional P12, percent of mothers with OUD receiving a prenatal pediatric consult. To qualify, the consult must occur prior to birth, either before or during the delivery hospitalization. To assess fetal opioid exposure, indicate if there is a maternal history or positive toxicology test via urine drug screen for any of the listed substances during the current pregnancy. Use prior to the pregnancy does not count, nor should we include if exposure was clearly only in the first trimester. Maternal history should be checked if a substance use was disclosed or discovered during screening. If the woman also tested positive via UDS, select the appropriate column for if the UDS was done prenatally or during the birth hospitalization. Some drug panels may list opiates as unspecified, while higher panels may specify which particular opiate was detected in a sample. Choose the most specific option available to you. In this scenario, we are going to indicate that the woman disclosed methadone use via prescription during the current pregnancy, and she also tested positive prenatally and during the birth hospitalization for methadone. Disclosure or history of other substances, nor toxicology for other substances was positive. Also indicate if alcohol or nicotine use occurred during the pregnancy. As part of our QI process, OPQIC would like to know how long it took for you to collect and enter this information. These questions are optional, but will help us as we attempt to make improvements in this process. Please consider the time it took for you to not only enter the information into REDCap, but also the time it took for you to collect the information. Select now to put a time and date stamp for the time that this data entry was completed. We will compare this to the time that you entered at the beginning of the form. Use this space to add any comments or questions regarding the data collection process. You may also contact us at redcap@opqic.org. Before changing the form status, we suggest that you click Save and Stay. This will save the data that you have entered, as well as provide a list of any required fields that you may have left blank. As you see here, we forgot to answer the question, mode of delivery. I'm going to click OK. And go and find that question to provide the answer. Now I will try Save and Stay again. And the save was complete. There are no more required fields that need to be answered. So now I can change the status of the form from incomplete to complete. If you are intending to come back to add more information, you can leave the record as incomplete. If all of the information has been entered, you can mark it as complete. The third option of unverified can be seen as an in-between option, in which the entry person believes all of the information has been entered, but is in the process of verifying or double-checking some of the answers. The lock is for OPQIC administrators. Once a form has been marked as complete, an OPQIC administrator will review the form for completeness. Once the form is verified as complete by OPQIC, we will lock the form so that no changes can be made. But don't worry, we can unlock the form if necessary. The design of locking forms is intended to prevent accidental deletion of data. Now click Save and Exit Form. This should take you to the record's homepage. You can see that the icon for the maternal form is now green, indicating that the form has been marked as complete. The delivery date now appears next to the record ID for easier identification of records. To return to the maternal form for this record, click on the now green status icon. Other options when saving a form include the option to save and go to the next form, which in this case will take you to the infant data form for the same record. Save and exit record will take you to the Add and Edit Records screen, and Save and Go to the next record will take you to the home page for the next record. Also note that these options are available to you at any time with this floating sidebar in the upper right part of the screen. You can always save and exit the form or save and stay and return later to finish entering the data. Let's save and go to the next form to begin entering the infant data. As you can see, we are still editing record number 1. Complete the first questions as in the maternal form. Choosing the scenario will modify the directions for which further sections of the form you are responsible for completing. We are going to choose that the situation is that mom and baby stayed at your hospital. In this section, we will input the infant's demographic information beginning with the date of birth. If this infant was part of a multiple pregnancy, complete this form with the information pertaining to one of the infants. We will say that this is infant A of a multiple pregnancy. At the end of the form, there will be an option to begin a separate form for another infant. Gestational age should be entered as weeks.days, as in the maternal form. And complete the rest of the information in this section as applicable. Tracking head circumference may help to identify infants who are at higher risk for impaired neurodevelopmental outcome. And for location of birth, for most of the time, we will notice hospital births. Select home birth if the infant was born at home. Selecting other will allow you to free text a location of birth, or we have the option of choosing unknown. Indicate the hospital of birth and the areas that the infant received care within the hospital. If an infant received care in a special care nursery or NICU, indicate the reason for the higher level of care. Indicate the infant's discharge disposition. The data from the question on discharge disposition will be used to answer the AIM process measure P3, percent of opioid-exposed newborns who go home to biological mother. Other options include placement with the other biological parent, not residing with the mother, or another family member, foster, or adoptive family. If you select that the infant is transferred to another facility, other questions regarding the transfer will appear. If this is not the situation for this infant, simply skip that question on the paper form. Section 2 addresses infant toxicology and testing. Indicate if an umbilical cord segment, meconium sample, or urine sample were sent for toxicology testing. If any of those specimens were not sent for testing, indicate by checking in the appropriate specimen column in the first row. If the specimen was sent but toxicology was negative, indicate that by checking the appropriate column in the second row. If there was any positive toxicology results, indicate in the row for the positive substance for that specific specimen. For example, this infant had an umbilical cord segment that was positive for methadone. Meconium and urine samples were not sent. Please note that exposure is assessed on the maternal data form and can be linked to this infant. This question on the infant form is asking solely for positive toxicology, regardless of if there is known exposure. Infants with exposure to any of these substances should have the appropriate ICD-10 code included in their medical record. Guidance on appropriate ICD-10 coding is available in our OMNO document on the OMNO Files page of the OPQIC website. Select any of the following tests for maternal STIs that may have been performed on the infant. Also select any anomalies that may have affected the infant, whether or not DHS was contacted to report a substance-exposed infant, and if you select No, we'd like for you to also include the reason why DHS was not contacted. And then indicate if DHS took custody of the infant during the birth hospitalization. Indicate if the infant experienced any symptoms for opioid withdrawal, such as GI symptoms like feeding problems, vomiting, or diarrhea, or neurosymptoms like irritability, sweating, tremors, or seizures. Select No if the infant had no symptoms, Yes if they only had primarily GI symptoms, Yes primarily neuro, or Yes a combination of GI and neurological symptoms. Select Yes if the symptoms are unknown or not documented. Also indicate which assessment method is used to assess withdrawal symptoms. for this particular newborn. We are using the Eat, Sleep, Console model. AIM process measure optional P13 measures the percent of opioid-exposed newborns who roomed together with mother during hospitalization. For specificity, OMNO has added the wording to include for any length of time. Answer yes to this question if there was any rooming in during the maternal hospitalization. To further assess rooming in processes, OMNO has added optional P13A, percent of opioid-exposed newborns who roomed together with mother during at least 50% of the duration of hospitalization. If the first rooming in question was answered yes, a second question will appear asking if the rooming in was at least 50% of the infant's hospitalization. If the rooming in was less than 50% of the stay, please indicate the reason. Reasons may include facilities are not available for rooming in, family's choice, infant medical issues unrelated to NAS, maternal medical issues, social issues, or other unknown reasons. Next are questions on infant feeding, the first of which asks if the infant is eligible to receive maternal milk. ACOG Committee Opinion Number 711 states that breastfeeding should be encouraged in women who are stable on their opioid agonists, who are not using illicit drugs, and who have no other contraindications such as HIV. Select if the infant is eligible to receive maternal milk and if a lactation consultation is completed. Indicate all of the infant's feeding sources during the hospital stay. You will note that if formula is selected, you can further specify the type of formula that the infant received. Also note that if maternal milk is not chosen, there's a question that applies asking if it was due to maternal choice or other factors. Answer the question to indicate if the infant received any concentrations more than 20 kilocalories per ounce, and include the infant's lowest weight during the first 10 days of age. This will give us an auto calculation of the weight nadir, which is a percentage of birth weight. To view the equation, you can click on that command, and you can see how it is automatically calculated based on the infant's birth weight, which we entered previously, to the lowest weight, which we just entered. The next section is on infant pharmacologic treatment. Data from this question will be used to calculate outcome measure optional 01, percent of opioid-exposed newborns requiring pharmacologic therapy. If the infant did not receive any pharmacologic treatment for NAS or NOWS, skip to the next section of questions. If an answer of yes is selected, questions regarding the pharmacologic treatment will appear. The only required questions regarding pharmacologic treatment are date of first and last dose. Data from those questions will be used to calculate outcome measure optional 02, number of days of pharmacological treatment for babies with NAS. The remaining questions are optional. Select which medications the infant received, and if the medication was either first line or second line, or prescribed as scheduled or as PRN. Also indicate if the infant was discharged on a medication, or if that medication was simply not used. Indicate the average NAS scores in the 24 hours before starting NAS therapy, and the average of the NAS scores for the 24 hours after starting pharmacotherapy. Indicate the date that the first dose was given, and the weight in grams on the day that that first dose was given. If an infant received methadone or morphine, you can include the total milligrams received in the first 24 hours of treatment, and throughout the entire stay. These will be used to calculate the MME for the infant during the stay. Here you can view the equation that's used to calculate MME. Indicate if the last dose was given in the hospital, if the infant had any respiratory depression or apnea from the opioid replacement therapy, and the date that the last dose was received. Length of pharmacological therapy will be auto-calculated based on that date. The last section contains questions regarding the infant's discharge and postpartum information. We ask when the infant is considered medically ready for discharge. An infant is considered medically ready when he is at least 96 hours of age, at least 24 hours out from requiring respiratory support, at least 24 hours from the last opioid replacement dose, and at least 24 hours of 100% oral intake. We're going to enter this infant's date of being medically ready for discharge as September 23rd. Based on the infant's birth date of September 17th, this calculated on day of life 6, the infant being medically ready for discharge. Indicate if the infant had any of the following diagnoses that may increase hospital length of stay. And input the final date of discharge. In this situation, we're going to say he was actually discharged on September 24th, which would be on the 7th day of life. By comparing the date of the infant is medically ready for discharge to the actual discharge date, we are hoping to identify areas of improvement that might help reduce length of stay for these infants. Comparing the infant's weight and head circumference at discharge to the birth weight and head circumference can help assess growth throughout the hospital stay. Note that head circumference is entered only if the infant's length of stay is greater than 13 days. This question will not appear in REDCap if the infant has had a shorter length of stay. The question regarding infant feeding at discharge is required, as it will help us report AIM process measure P2, percent of opioid-exposed newborns receiving mother's milk at discharge. If it is indicated that the infant is receiving any type of formula, the questions regarding the specific type of formula will appear. The last questions on the infant form are regarding documentation and follow-up. Hospitals wanting to gather information about their documentation will want to answer the questions about the discharge summary and the PCP appointment. The question regarding early intervention referral is required, as we will use that report, AIM process measure optional P14, percent of opioid-exposed newborns with appropriate follow-up at discharge. Let's click Save and Stay and ensure that we have completed all of the required fields. The save was successful, so now I can go back down to the bottom of the form to mark the form as complete. If this were a singleton, we would simply save and exit this form. But remember, we indicated that this infant was part of a multiple pregnancy. These directions remind us to click Save and Add New Instance. This will open a blank form for the next multiple. Here we see indication that this is instance number 2 of the same record. Let's see how this looks on the record dashboard. We'll ignore the warnings for now. Now we have a completed maternal form and multiple instances of an infant data form. We can see that instance number 1 for the infant form is marked as complete, but instance number 2, which we saved and had required fields left to be filled in, is marked as incomplete. We can click on either of those status icons to access those forms. Once you have completed all of the data entry and have marked all of the forms as complete, They will then all appear as green on the record dashboard. OPQIC will review the information and will lock a form once it is determined to be complete. You can see which forms have been locked by indicating on the All Status Types and noticing the lock icon next to the status icons. Again, here is the legend for the colors of the different statuses that a form might be in.